This is Rogers TV, Barrie.
Since I last reported on March the 2nd, we've had a substantial increase in our cases. So we're now up to a total of 37,445 cases since the beginning of the pandemic. The fifth wave actually has surpassed all previous waves combined. We've had more cases occur in the fifth wave than the other previous waves. And that's despite the fact that the approach to testing has been narrowed to only be those who live or work in congregate settings or high-risk settings. And we've had a total of 151 deaths occurred in the fifth wave. And that actually makes it the wave with the greatest number of deaths now. Wave 2 had the second highest number of deaths at 143 deaths. And in fact, there was a weekly death rate in the fifth wave of, on average, 10 deaths, as opposed to 5 in the second wave. So in terms of time, duration of the wave, considerably higher mortality rate. We've also had the highest hospitalization rate in the fifth wave compared to previous waves. And we've also, since for the past 11 weeks, we now have had an increase for the first time in our incidence of cases. So the incidence has gone up 36% between the week of March the 13th and 19th, during that week, from the 13th to the 19th, compared with the previous week. So specifically, we had 590 cases over that period of time, compared with 433 cases the preceding week, March the 2nd to the 12th. The majority of these have been attributed to those who are over 65 years of age. The province's incidence has remained stable over that period of time. So we've had a significant increase where the province has decreased by 1% overall. And so our incidence of cases per 100,000 population is now up to 96 cases per 100,000 population per week, compared with the province's which is at 77 cases per 100,000 population per week. So significantly higher now than the provincial rate, whereas earlier in the fifth wave, we were riding at the same level as the province. A significant number of people who are cases have been vaccinated. So 13% of the cases, March the 13th to the 19th, were unvaccinated. 85% had 2 or more immunizations, and 2% were partially vaccinated with a single dose. We note, though, that there's still, on an individual level, a high degree of protection. You're much more protected with vaccination, particularly with a third dose, but also with 2 doses, against severity compared with those who are unimmunized. So those who are unimmunized are 4 times more likely to be admitted to a hospital, 8 times more likely to be admitted to the intensive care unit, and 3 times more likely to die. So still very, very important to receive people receive immunization, but also very important that people know that transmission indeed can and does occur among people who are vaccinated. Higher degree of protection with 3 doses. 2 doses really, although important for preventing severity, is not protective against transmission. So people need to exercise the other precautionary measures as well to avoid transmission. And also, we are experiencing a high degree of transmission at this time and some elevation occurring now compared with a week ago. In terms of hospitalization, we're having a slow downward trend. So at this point in time, 20 individuals from Simcoe Muskoka are hospitalized compared with 23 2 weeks ago, and 4 are in the intensive care unit compared with 6 2 weeks ago. We have 70% of those individuals hospitalized who are 65 years of age or older. 18 are from Simcoe County, 2 are from Muskoka. 90% of them are sporadic cases. 2 of the cases are associated with institutional outbreaks. 30% of them are unimmunized. 20% of them have had 2 doses of vaccination. That would be 4 individuals. 2 individuals were partially vaccinated, single dose vaccination. And 8 of those individuals, or 40% of the cases, have had 3 doses of vaccination. Over the past 2 weeks, we've had 16 additional deaths, and I would like to express my condolences to the family members for your loss. 10 of them are men, 6 women, 15 from Simcoe County, 1 from Muskoka. 4 were associated with outbreaks in 2 long-term care facilities. 2 were not vaccinated, 1 partially vaccinated, so single dose. 5 of them had received 2 doses, and 8 had received 3 doses of vaccination. So, as I'd indicated before, vaccination is very important for reducing the likelihood of severity, but it is not completely protective, and people need to be aware of that, aware of the high degree of transmission happening now, and exercising the other precautionary measures. We've noted during the 5th wave in 2022 that 45% of the deaths have been associated with outbreaks, and that this proportion has actually been declining in the weeks that have transpired into the year. So for the month of March to date, 19% of our deaths have occurred associated with outbreaks in long-term care facilities. So that's down from what it had been earlier in the year. At this point in time, we have 23 outbreaks, which is up from 15 2 weeks ago. So among those, 10 are occurring in congregate settings, so 9 of them in group homes, and 1 in another type of congregate facility. And this is up from 2 weeks ago. 9 are in institutions, up from 7 2 weeks ago. So 5 of these are in long-term care facilities, up from 1 2 weeks ago, and 4 of them are in retirement homes, which is unchanged from 2 weeks ago. And 4 of them are in childcare settings, which is down from 6 2 weeks ago. In terms of immunization, we're now, for some time, actually been progressing at a very limited rate of vaccination. So the tally that we have right now for those that are 12 or more years of age is 88% have had a single dose, 86% have had 2 doses, 53%, and those 2 figures are unchanged over the last 2 weeks, and then 53% have received a 3rd dose, which is up by 1 percentage point from 2 weeks ago. Just to give you a sense as to how much vaccine is being provided at this time, since March 21st, we have provided an additional 294 third doses in Simcoe Muskoka. And for children 5 to 11 years of age, 49% in Simcoe Muskoka have received their first dose. So not much additional uptake. We've had since March 21st, 60 pediatric vaccinations provided in Simcoe Muskoka, just to give you a sense as to the volume of vaccine now that that we're getting uptake on. We are continuing with the provision of vaccine in schools and are managing to pick up some individuals, some children for first doses and second doses. Okay. We do monitor wastewater for COVID-19 in 4 of our municipalities, and we have noted the science, the Ontario COVID Science Advisory Tables report from last week that cited an upward trend now in wastewater surveillance results, indicating evidence of increasing transmission in communities across the province. This varying by location in the province, quite a bit higher in Northern Ontario. But here in the Central East region, which includes Simcoe Muskoka, there's now the suggestion of an increase across health units in transmission. And we've had a slight increase in our sample collection in the municipal wastewater system for Barrie, with our other 3 municipalities, Collingwood, Midland, and really a stable plateau, not coming down. The science table, as I'd indicated, put out a report last week that noted the potential for some increase in transmission in the months later in the spring, affecting hospitalization, but very unlikely to be of a similar impact to what was experienced in January. But also noting that there appears to be a slight trend upward now in transmission in our communities, even at this time. And they do make some recommendations with regards to the importance of people taking precautions at this time. And with regards to our monitoring dashboard, it remains in red status due to its overall indicators being consistent with that. So today I'm putting out a special statement to those who live and work in or visit Simcoe Muskoka, and basically identifying that indeed the pandemic has been a historic and severe experience with many, many people becoming ill, many people becoming seriously ill, and tragically over 400 of our own citizens in Simcoe Muskoka having passed away to date. And that although we've made progress and the transmission has come down greatly since January, it still remains at quite a high level, meaning that there is significant risk of transmission in our community for people, and that people need to be aware of that. And the province now is lifting most of the public health measures. And so I'm advising that individuals exercise these measures to reduce your risk. Vaccination is the single most important thing that people can do. And getting a third dose, getting a booster dose is particularly important. 2 doses provide some degree of protection against severity, but we are seeing severe cases still and deaths occurring even among the vaccinated. So a third dose is quite a bit more protective against severity and provides some degree of protection against transmission. And it's really just over half of our population that is eligible, that's received that third dose. So I am recommending that people come forward and receive that third dose. And there's still opportunities for people to do that. And I also note that although people are not required to wear masks in most settings, there are still some settings where it's required: healthcare, congregate care settings, public transit settings, but otherwise, by provincial direction, there isn't a requirement for wearing masks, but masks are still important and protective. We are continuing to see transmission, and I recommend that people continue to wear masks in indoor public settings and workplace settings where you cannot be physically distanced from others, and that people be aware of and exercise the other precautionary measures as well. Hand washing continues to be very important. Self-monitoring for symptoms and isolation if you develop symptoms. If you have had a close contact with an individual who's a case, look at the provincial guidelines now for what's required to reduce transmission, including the potential for isolation for yourself, and that people also, where you can, exercise physical distancing as well. These things remain important, even though they are not actually, for the most part, required of you. This is to reduce your risk of becoming a case and transmitting to others. And in the case of vaccination, reduce the likelihood of severity as well. I would note that we may get a surge. We're experiencing some right now. We may get a surge later in the summer, or this, I should say, the spring, noting the science tables modeling. But I'm hopeful that later in the spring and into the summer, we will have lower rates of transmission. And we've missed out a great deal on social contact with friends and family and people that we care for. And as things improve, certainly I would be advising people to take advantage of that opportunity to be together with people, be mindful of these practices to reduce your risk. And outdoors is always a safer option. So as weather improves, taking advantage of the outdoors for that kind of social contact is very important for our well-being and our quality of life. I also note that the pandemic is very much continuing in the world, and there are other parts of the world that are experiencing surges now. And there's the potential for variants of concern in the future to come at any time, and that COVID-19 is behaving in a seasonal way. So we may very well see a rise in COVID-19 again next fall and winter. So it's important that people be aware of that and to monitor what advice is being given going forward in time, and to adapt to allow yourselves to be able to contact people in a safe manner as opportunity increases going forward, hopefully when numbers go down, and using the outdoors as more of an opportunity, and being mindful of the other practices that I'm recommending. So with regards to vaccination, we continue to provide vaccination. People continue to have the opportunity for vaccination. We are certainly planning for the potential to provide additional doses if and when the province would be directing us to do that later in the year. And so it'd be important for people to be thinking about keeping up to date with recommendations for vaccination and accepting all the vaccination that you're eligible for. We can get waning or reducing immunity post-vaccination. So that would be a reason why we might see future doses recommended. And at this point in time, certainly recommending people get all that they can, people getting the third dose for those who've had 2 doses already. So on March the 19th, we will be changing to a walk-in model for our community vaccination clinics rather than booking. So make it easier for people to be able to get vaccinated. And our clinic hours are going to be changing, reducing in scope to reflect the fact that we're getting low uptake from people. So just to be more sustainable for ourselves. So please look online for our hours. We are changing to noon to 5 p.m. on weekdays and 9 till 4 on weekends. Starting March 31st, our community-based clinics will be closing except for in the Georgian Mall in Barrie and at the Aurelia YMCA clinic. These will operate until the end of April. Georgian Mall, Fridays from 12 to 5 and Saturday from 9 to 4. And in Aurelia, Mondays and Wednesdays from 12 until 5 p.m. And please note that all of our clinics will be closed on the Easter weekend and statutory holidays. And all eligible individuals would be able to come and receive vaccination at these clinics. These would be children who are 5 to 11 and all other age groups, including for boosters. The walk-in opportunity for people to get their vaccination. And also, we will continue with pop-up clinics in particular locations. So please have a look at our website for the details on that. And also the GoVax bus providing vaccination as well. And we will be putting out public service announcements on a regular basis about these opportunities. So our pop-up clinics and GoVax bus clinics are meant to be a convenient way for people in those locales to be able to get vaccines, so to bring vaccination closer to certain communities. And these clinics will continue into April. The vaccination clinic operated by RVH at 29 Sperling, I would really like to commend RVH for having provided vaccination at this site throughout the entirety of the pandemic. That was the first clinic we had in Simcoe, Muskoka come into operation, and they provided about a third of the total volume of vaccine that has been provided. So really want to commend them. And they continue to operate 29 Sperling Drive on Tuesdays, Thursdays, and Sundays from 10 a.m. till 6 p.m. And appointments by walk-in and scheduled appointments are still accepted at this location and can be booked using the provincial booking system. And there are other options as well for people, participating community pharmacies with booked appointments, as well as some primary care providers. So important that people be aware of these opportunities and take these opportunities to get fully immunized, up to date, and with all vaccines that you're eligible for, including booster doses for those 12 and above. So we are, as a health unit, transitioning back to getting our staff back into the regular programming and getting our regular public health programming up and running again, with a focus that includes the provision of routine childhood immunizations and the immunizations that we provide in schools. Beyond the COVID vaccines, the other vaccines that we traditionally provide in schools, but have not been able to do through the pandemic. So that's an area of focus for us later in the spring and into the fall. And as I'd indicated, we do anticipate more direction from the province with regards to the potential for more booster doses for COVID-19, more vaccination of COVID-19 later in the year. And we'll certainly communicate on that as that arises. So for 2 years, I've been holding regular press conferences on COVID-19, and I am fully committed to continue to provide information on COVID-19 through the media and via my team through social media. At this point in time, we are going to stop our regular press conferences and change them to be on an ad needs basis and to be available otherwise for media contact on an ongoing basis. So at this point, I would be happy to take questions.
Thank you, Dr. Gardner, for your update this afternoon. We will now take some questions from the media. As always, we do ask that those who are participating limit themselves to one question and one follow-up in consideration of time. Can we start with Chris Simon from the Barrie Advance? Do you have a question this afternoon?
I always do. Thank you very much, Kara. Dr. Gardner, hi. I'm glad you touched on the point about transitioning staff back over into other immunization programs. Do you have an idea when you may begin to transfer other staff into other programs and resume some of that stuff as well?
Yeah, thank you very much, Chris, for the question. I would say that we've already transferred quite a few staff in the past couple of weeks and anticipate being able to do more so in the weeks to come. So it's a gradual process, but happening fairly quickly at this time.
Okay.
It will, I guess I should position, it will take us some time to be able to actually get up and running all of our other programs. And we've identified particular areas of focus to ensure that we get an early start on them. And one of the areas is childhood vaccinations that I've already cited.
Do you have an estimate? I mean, this might be not a fair question, but do you have an estimate when the health unit may get back to some level of normalcy?
It is hard to say. And part of the reason for that is that depends on the course of the pandemic from here as well. So as I pointed out, we're at a fairly high level of transmission. We're still quite busy with outbreak response. Vaccination has fallen off considerably, but we're going to be switching over very much to catch-up vaccination for childhood vaccines. So the course of the pandemic itself will impact on that. We have a lot of groundwork to do to take stock of our routine program delivery in order to be able to decide exactly where and when and how to begin. So it will take, I think, many weeks through much of the year to be able to get up on a goodly number of our programs. And the degree to which we're able to do so is going to depend in part on the course of the pandemic itself.
Thank you very much, and appreciated the last 2 years of your time.
Likewise. I'm very appreciative of the media.
Erica Engel from Collingwood Today. Do you have a question?
Yes, thank you. First, I just wanted to confirm there haven't been any routine vaccinations in schools since spring 2020. Is that correct?
We attempted last year to commence again and then had to put that on hold in order to provide booster doses in the fall for COVID-19. So we've really not been able to provide vaccination, the grade 7 program, for the duration of the pandemic.
Okay, thank you. This is a little bit abstract, but I was wondering, as you're taking stock of your, pre-COVID programming as a health unit, do you foresee some new programming or new focuses for the health unit that have sort of come about because of the pandemic, but maybe aren't like COVID vaccines? Do you know what I mean?
Mm-hmm. Well, one of the areas of importance would be mental health promotion and addressing substance use and the opioid crisis, which has become considerably more severe through the pandemic. So we've had 80% or more increase in opioid deaths through the pandemic compared with pre-pandemic. So those are some areas for focus for us. The childhood vaccination catch-up is an area of focus for us. Inspections for food premises would be an area of focus for us. Other than that, really taking stock overall of where our gaps are, what we can commence at this time would be important for us to be able to do right now as well.
Okay, sorry, did you say opioid deaths are up 80% compared to, wow, okay.
Yes.
I wanted to echo what Chris said. I think it's been very helpful to have you available as much as you have been on a regular basis. So I think I appreciate the communication from you and the health unit.
Thank you very much. I appreciate the acknowledgement. I'd like to acknowledge my own media team. They've been indispensable support to me. My staff in general, I would like to acknowledge. People have had to work extremely hard, be very adaptable, spend 2 years, many of them redeployed to work that they weren't doing before the pandemic. I wish to acknowledge them all.
Matthew Riesler from Moose FM, do you have a question today?
I don't have a question. Well, I guess it's a question. I'm just, now that you're not doing these weekly briefings, what would you recommend if we do have a question about local COVID numbers? Would you recommend we email you directly, or is there someone we should reach out to for a comment?
We have our media contacts in the agency. I'd recommend that you work through them. They are very good about getting in touch with myself and other spokespersons in the agency, other associate MOHs for a response.
Okay. And I'll echo what everyone else is saying. I appreciate what you've done over the past 2 years. Having you on weekly has been a lot of help, making sure to get the word out.
Thank you.
And Matthew, I can follow up with some contact information after. Mary Beth Hartle from Muskoka Region, do you have a question?
I do. First of all, I want to thank you for mentioning the mental health thing, because that was going to be one of my questions with people being under so much pressure during the pandemic. The other thing I wanted to ask you is, as you know, Muskoka-wide, I rely heavily on your meetings for my Muskoka numbers. Are we going to be getting those back on the website, or what's going to be happening with our online updates?
I regret to tell you, I don't think we're going to be able to go back to that. We just haven't had the quality of testing data to be able to commit to taking it down to that level. So if for some reason that were to change, we'd be happy to communicate that out, but I don't anticipate it.
Not even the number of deaths, because we're not getting those right now.
Well, verbally, although I would admit now I'm not going to be having regular press conferences, but I'll remain available. Verbally, I've spoken to, even today, the numbers of deaths that were in Muskoka as opposed to Simcoe County. So by all means, keep raising it and we'll see what we can do.
Okay, thank you very much. And thank you for 2 years worth of jets.
Thank you.
James Bowler from Cogeco.
Thank you. Wow, I got to make this a good one because it's going to be my last one for this. Dr. Gardner, we've had discussions about the COVID situation never really going away, always kind of being around in terms of maybe more of a flu-like situation. And that leads me to a question. Is the health unit anticipating keeping a sort of COVID-focused department moving forward, much like what you do with the flu tracking? Is that going to be a similar situation? And will you be keeping track of, biannual vaccinations or whatever comes forward in the future?
I have no doubt that we will continue for probably a number of years having a program that's about COVID, both on the communicable disease side of things with case and contact, and in particular outbreak response, and also vaccination. No doubt there'll continue to be some media focus on it, so public messaging. If we get into regulatory content in the future with future surges, provincial mandates of some kind, then we would be back into education and enforcement as well. So we will need to continue with a level of dedication of resources and organization to deal with COVID going forward in time. What we need to do as much as possible is strike a balance between that and having our resources devoted to our other programs.
And I'm going to take an opportunity to ask a second question, and that would be, what would you say are your biggest lessons learned from these 2 years? I mean, this has been an unprecedented situation and obviously a good learning experience for all health officials, but specifically for you in Simcoe Muskoka, what have you learned from this? What types of things might you be using moving forward that were helpful in this scenario?
I would say that the community approach has been my I guess the strongest impression that I'm left with from the whole thing, that we've had so many sectors and agencies come together in response to this situation. We've really developed our working relationship with them, with certainly throughout the healthcare system, primary care, hospitals, and long-term care, pharmacies, but also municipalities and first responders and the business community. It's created ties, much stronger ties than we had before. The number of volunteers that we've had has been astonishing. We've had over 600 volunteers assisting in our vaccination clinics. So just the strength of people coming forward out of the goodness of their hearts to help with the response has been an inspiration to me. The willingness of my staff to put in a lot of extra hours and to take on work that they normally had not been doing before is an inspiration to me. The dedication and support of my board of health has been an inspiration to me. So to me, I guess the greatest learning of all is, in a crisis of this nature, look to the community to come together. That is what is needed and what happens.
Well, listen, I also want to express my appreciation. It's been a tough 2 years. I think we've all hit some frustration levels, and we've asked some tough questions of you, but you've always been there to answer them. And I think we all appreciate that open and honest approach, so that we can get some guidance in the community. So thank you.
Thank you so much. And I'll say again, the media has been an absolutely indispensable part of that community response. And I thank you all for it.
Mark Claremont from Muskoka Today. Do you have a question this afternoon?
Yes, thank you very much. And I'll start off by offering my kudos to my colleagues in the media for asking the questions that are very important that I didn't get an opportunity to ask in my two choices. Today, I'll start off with Dr. Gardner. So going ahead, how will you gauge the severity of COVID if you're only testing high risk and congregate areas? And did you say congregate areas are particularly troublesome throughout the pandemic? But are you only going to rely on hospitalizations to determine how severe this COVID is this coming spring 22?
Good questions. One thing I would say is that the change in the testing protocol to be focused on those living and working in high-risk settings in healthcare and congregate settings narrows our scope of information about what's happening in the community. And I don't think that that's going to change. I think that'll continue. So to get a broader picture of the community, we'll now need to rely on other sources of information, the numbers of outbreaks, but even there, we're looking at congregate settings and hospitals, long-term care facilities. So we aren't getting the full picture of the community and the outbreaks happening in the community there either. The wastewater surveillance is important. It's a new tool for us, so we're learning how to use it, but it's better for the bigger picture. It doesn't take us down to every community. We have 4 communities that are participating in that. There's potential in the future to include more of them. I think that would be helpful. That is what we really have at this point in time about the incidence of transmission. It's not as complete as I would like or what we had before with the broader testing, but it is what we have at this time. And then when it comes to severity, really that's been about hospitalizations, ICU admissions, and mortality all the way through the pandemic, and that will continue.
Okay. Very much. And just switching gears a little bit there, do you have any comment on the dental deal that the federal government set up with the NDP and how that could ultimately relate to a pharmacare, universal pharmacare system?
We've been using these venues for COVID. So I think what I would ask is you channel that question through our media contacts for comment, rather than me responding to something that's not on topic.
Okay, I'll follow it up. But anyway, and as usual, thanks very much. And please do stay in touch with us there.
Thank you, and I will.
Thanks.
Can we go over to the phone line? Do we have any questions from our phone this afternoon? Okay. And was there anyone who didn't have the opportunity to ask a question this afternoon? Okay. And Erica, I did notice that you had put a question in the chat box. Given that it is an opioid-related question, perhaps I will follow up with you after. I believe that brings us to the end of our media briefing. Once again, Dr. Gardner, thank you so much for your update and all of your updates over the last 2 years. And thank you so much to the media for your participation and partnership.
Thank you, everybody, and best wishes. Be well. Bye-bye.
Recording stopped.
Like that's sort of the picture that I have. Everybody sort of lives in their own, fenced in yards built by HD and with the what do you call the tight board fencing, et cetera. If we actually were to think about, how about going a different approach? And how about building communities whereby we can not open a pool, use the pool maybe once a week on a weekend, and then close the pool and have all that wasted energy, have that all wasted space, have all that concrete in our backyard. But if we actually started building neighborhoods and building subdivisions.
More so the condominium concept.
If the development community, if the building community started building neighborhoods differently. And again, you can take this any way you want. And certainly, I think when we come back to round out the show, we're going to talk about some things. I want to plant the seed right now about what can municipalities do a little bit differently. But what can we as individuals demand differently than we have in the past?
Well, that's in its infancy. I think we're still getting our head around the whole concept of firstly building those more intense communities. Now we're looking at, well, how can we make these better? How can we utilize this? What opportunities and advantages are there? And you touched on one. There's no need for everybody to have a pool if they're only using it for 2 hours a week. And I think that same mindset is going to, in time, apply to automobiles. Instead of each of us owning our own individual car that we drive once or twice, there's Uber. But I have a feeling once we have autonomous cars, you'll just call up the car, so the car's going to show up.
I'm going to call Iron Man.
Yeah.
But so here's the reality. We're already doing these things. First of all, what we're talking about now isn't foreign.
No.
It's new. We already have condominiumized settings. We already have communities. We've already got rec centers.
But we're not applying them
We're not applying it to the maximum potential that we could. So why not? But you're absolutely right, Mike. We already do ride sharing. We already do bicycle sharing. We do lots of things that we share.
Communities that are close to, in proximity to, or adjacent to the water oftentimes have a deeded beach that's accessible only to